Opioids, also known as opiates, we're talking about drugs from the morphine family here, and humans have used morphine-based drugs for an incredibly long time, and morphine is the standard painkiller across the world. And it is an excellent drug. However, there are many well-known side effects associated with it. It is particularly good for acute pain. So after you've had an operation, we've had a bad accident, say, you would have strong opioids. They would get you comfortable and help you rehabilitate afterwards. However, for chronic pain, opioids are less useful. They can be very helpful for a minority of patients, but the side effects that people often talk about are constipation. They can affect your immune system. They can affect your concentration. You have to tell the DVLA if you're on opioids as well, especially if you're changing the dose. Other things that can happen, they can cause a reduction in the hormone secretion, so testosterone, estrogen, and so on. And if patients are on high dose for a long period of time, it would be best to check their hormone function and replace it if necessary. There's also a strange phenomenon called opioid-induced hyperalgesia. So this is quite paradoxical because although opioids are very useful for treating pain, if the patient's been on them for a long period of time, they can also cause a hypersensitization of the nervous system, which means they make people more sensitive to pain. And therefore, when you increase the dose, it might actually make the pain worse. So it's something to be aware of. And although it seems paradoxical, it's a very real thing backed up in the scientific literature.